Welcome to the Golden Jubilee National Hospital, part of the National Wait Time Centre, which also includes the 4-star Beardmore Hotel and Conference Facility. I'm Jill Young, Chief Executive, and I'm delighted to introduce and support the nursing philosophy of care. It's very important for us here. We're quite unique. We're a national hospital and we receive patients from all over Scotland, and therefore it's critically important that the care our patients receive is of the highest quality. In order to do that, we need to make sure that all of our team, but especially our nurses, are highly trained, are competent and skilled to deliver the care that patients expect. What we provide here is two main specialties. We have a huge centre for orthopaedics, and we're one of the largest heart and lung centres in the United Kingdom, as well as a range of other surgical procedures. And it's important that we deliver the highest quality of care possible for all of our patients. We've aligned our philosophy of care to the quality strategy for Scotland's three main themes. The first one being that patients and people's views are foremost. We need to deliver what they expect from the NHS and from this hospital in particular. Secondly, we can only do that if we value our staff, make sure they're trained, they're highly competent, and they're confident and comfortable to deliver the care we expect of them. And thirdly, we need to make sure whatever we do gives continuous improvement, that all the changes we make delivers real improvement of care for our patients. We can only do that if we have the best philosophy of nursing care. And I hope you will enjoy listening to how they truly make a difference.
Hello and welcome to the Golden Jubilee National Hospital. My name's Shona Shaib and I'm the Executive Nurse Director. Through hearing what our nurses and patients say, you'll discover the human and professional values and principles of care that are important to them. At times we can all feel vulnerable, frightened and uncertain, and this is as true for our nurses as it is for our patients and their families. And so our nursing philosophy underpins our aim to deliver the highest quality of care to our patients and is divided into two themes, extending beyond the care of patients to the care of their families and our own staff. Every piece of care matters. Nursing professionalism is both our knowledge and skills, and of equal importance is the way we apply them so that our patients are our partners and are at the centre of care. This means that we deliver person-centred care, understanding the unique needs of individual patients as much as possible while in our care. And every piece of you matters. We support our staff to focus on the values of nursing and our role in working within a caring profession. We understand that the things that make us feel valued, development, support, respect, help us to enjoy our work and feel we are making a difference to patients. Our nurses are delivering extraordinary and highly specialised care every day. Let's hear from some of them and from some patients to which this matters most.
The orthopaedic department has been at the forefront of the development of the Caledonian technique. This technique allows patients who are admitted to hospital for major joint surgery to be mobilised within hours. We aim to ensure patients are fully involved in their care and that the Golden Jubilee Hospital is at the forefront of revolutionary new practices within orthopaedic surgery.
When I was in as a patient, you were only concerned with yourself. When I was in as a carer, shall we say, seeing the care and attention that she got was far more important to me than what it was when I was a patient. Well, when my wife was in one day, and then for the next 3 days she was, after the operation, she was in the high dependency unit. But, for a retired, we were together 24 hours a day, that having these 8-9 hours together every day, just the fact that I was there, just seeing what was going on and seeing her improving, it was wonderful as far as I was concerned. They were efficient, but they were friendly at the same time, which is, I feel, is very important. Oh, I think this hospital is absolutely wonderful. I may be biased, I don't know, but I feel this hospital is the blueprint for every hospital in Scotland or Britain, shall we say.
I had to have a triple up bypass that was a bit of a shock. I just settled in and everybody came in and attended to me. And see the actual leaflet you get before you come in, it's actually composed by patients. You know, what they say happened to them, and I read that thoroughly, and when I was in, everything they said in this leaflet was the way I was treated. But she was telling me everything as she was going on, and it eases you. They'll say, oh, it won't hurt, or this will just hurt for a second, or whatever.
It's about feeling safe. But they immediately made my life better, and they tried to make me feel welcome. But you talk to them about their careers, their jobs, their lives, their families, and you know, and they're your connection with the outside world. You know, a week's a long time when you're on your first life support machine, and you know, so you go back and you have to get to know them again. And but very quickly, when I got back to the heart failure ward, that the nurses were great. You know, everybody looked after me so well, but they were friendly. You get that feeling that they care. There was no time in the hospital that I ever felt that any of the nurses that I dealt with were doing it because it was their job. And that was the wonderful thing. They did it because, well, I believed because they cared. You know, I really liked to cut out the Golden Jubilees. The staff here helped me through it. They just looked after me so well. You know, I just love them to bits.
The most significant and pleasing aspect of the care I received was that I felt cared for and valued as a person. The staff were very busy, but it was clear that everything had to be run like clockwork to fit in all the patients in the ward. However, the support and information, communication and everything I received was in really strong supply. I felt there was excellent communication with the staff. What I felt most, that it was good that they knew about my family, especially my son was studying for exams at that time, and the staff used to ask me on a daily basis how he was doing each day. I felt that they saw me as a person and not just as a patient having surgery. I was amazed by the standard of care that I received at the Golden Jubilee National Hospital.
Walking into the hospital, walking into the hotel, it's the brightness and the cleanliness of the whole place, staff being friendly and approachable, and it's a nice environment, you know, to work in. It's a nice place, nice clean place to work in.
Well, part of the nursing philosophy is wanting to give a high standard of care, not only and support not only to the patients and their relatives, but to the staff, which I've seen just any person that's admitted to any of the wards that I've been on, their relatives are right away taken in, and everything's explained not only to the patient but also to the relatives, because not only is it a scary time for the person actually coming into hospital, but sometimes it can be quite scary for a partner. Also the staff as well are well supported. From a student's point of view, I've always felt that I've been highly supported in any of the placements within the hospital, and just as a multidisciplinary team, they work really well together with like, the physios and the occupational therapists, and the protected meal times are kept here as well, which is a good thing because the patients then know that when it comes meal time, they will get that hour and a half where no one will be in to take them for tests or to do anything with them while they're eating their meals.
I mean, there's a difference between hearing and listening. You can hear things, but listening to things that they say is more important than actually hearing what they say. And I think that is one of the most important things, you know, in developing your relationship with patients.
I think it's very important that they're all individuals. We see a whole variety of patients day to day. You're never quite sure who the next patient is going to come through the door to us is. So they've all got their own stories, their own life events, experiences, and I think each one of them have got their own challenges that they bring to us. So they are all very much individual, and I think we try, certainly in the coronary care unit, to treat them all to meet their own needs as much as possible.
And that's one of our specialist roles, is trying to look after somebody that can't tell you, and just remembering how you would want to be treated if you were lying there. If you always think back, if I had a family member lying there and I saw how they wanted to be treated, I would always make sure I looked after them the way I would want to be treated.
That's been one of my philosophies throughout nursing, is to always treat the patient the way I would like to be treated myself.
I think it's really important for the patients to feel that they've had personalised care, and that they feel that valued, and that we've actually made their experience a good one in the ward. A smile, just the way you speak to the patient, communicate with them, is actually, I think, more important to the patient again than just purely carrying out a task. Anyone can walk in, do a task and walk back out, but it's how you approach them, how you communicate with them, and that actually makes them feel valued, and that their stay's been a good one. And all the feedback we get back from patients is purely around how staff have been towards them and how their attitude has been.